Hello everyone, my name is Dr. Sophia David, and today in this video I'm going to talk about how to generate a good hypothesis list for a case-based learning or a CBL case. Case-based learning is the most commonly used active learning technique in all of the med schools. Let's look at how to generate a hypothesis list. While generating a list, you want to consider two main things: the systems that could possibly be involved and mechanisms that could be producing such symptoms in our patient. Um, First, let's consider the systems that could be involved, or all the systems in the body. For this, I use the mnemonic Mr. Dice runs. Uh, in the mnemonic, M stands for muscular system, R stands for the respiratory, D digestive or the gastrointestinal tract, I integumentary or the dermatological conditions, C circulatory, which includes the cardiovascular system, E endocrine, which includes the thyroid, pancreas, adrenals, pituitary, R reproductive, which involves all the reproductive organs, urinary system, which involves your kidneys, ureters, bladder, urethra, nervous system that would include spinal tract, spinal cord, cranial nerves and peripheral nerves, and the skeletal system, or anything that's affecting the bones. Next, let's take a look at the mechanisms that could affect different systems. To get a list of mechanisms, Vindicate is a good mnemonic to go for. In Vindicate, V stands for vascular, which includes mechanisms like ischemia, infarction, thrombus formation, embolic phenomenon, hemorrhage, infectious. I stands for infectious or inflammatory processes. Consider infections like bacterial infections, viral infections, fungi, parasites, and prions, or any non-infectious inflammatory conditions. Neoplastic would include your tumors. Tumors can directly produce certain symptoms and indirectly produce symptoms by compressing the nearby structures or producing substances through paraneoplastic syndromes. D stands for degenerative and drugs. Degenerative includes any changes that's brought about by normal aging or secondary to a surgical procedure or a traumatic event. D stands for drugs as well. Drugs include medications which could be producing anaphylactic reaction, side effects, or signs and symptoms of overdose. I stands for iatrogenic and intoxication. So any invasive or non-invasive procedure that could be producing signs and symptoms in a patient, or intoxication of alcohol or recreational drugs that can produce symptoms. C stands for congenital, which is self-explanatory. A stands for autoimmune conditions, where you have your own cells fighting against your own tissue through mechanisms like molecular mimicry. T stands for traumatic, in which case patient would have history of trauma. E stands for endocrine/metabolic, which includes endocrine disorders and metabolic disorders that could affect the systems and your electrolyte imbalances as well. Now let's take a look at an example. Consider a 30-year-old male presenting with abdominal pain. Now, while generating hypothesis list, it's very important to consider the background information of the patient and the other associated signs and symptoms. In this case, we only have the age and the gender of the patient and his presenting symptom as abdominal pain. Since we've narrowed it down to the abdominal region, the possible systems that could be involved are GIT or the digestive system, respiratory, circulatory, endocrine, reproductive, urinary systems. Let's go through one by one. When you consider digestive system, think of all possible mechanisms that could help you come up with a differential. So a vascular cause of abdominal pain within the GIT would be a ruptured AAA, a mesenteric ischemia secondary to AFib, infectious causes like gastroenteritis, neoplastic causes like gastric tumors, intestinal tumors, degenerative changes like normal aging producing decrease in gastric motility, or drugs, especially antibiotics, causing side effects like nausea, vomiting, or overgrowth of C. difficile causing pseudomembranous colitis, iatrogenic causes like invasive procedures, including colonoscopy or endoscopy that the patient might have had recently. Alcohol intoxication can produce abdominal pain too. Patient could have had a congenital issue um, for which he could have had a surgical procedure, or this could be an acute or chronic presentation secondary to a congenital issue. Autoimmune disorders like Crohn's disease, inflammatory bowel disease can also produce abdominal pain. Patient could have suffered a trauma causing spleen rupture or liver infarction, or even perforation of your intestines, endocrine issue, especially like a diabetic mellitus, in which DKA can cause acute abdominal pain, which would be diffuse as well. You could also possibly look at other systems, which would be your respiratory system. A good example would be lower lobe pneumonia causing upper abdominal pain, or circulatory system, cardiovascular issues like myocardial infarction, acute coronary syndrome, producing upper abdominal or GI epigastric pain. Endocrine, we talked about diabetes mellitus. It could be a ruptured ectopic, torsion of testes, or ovarian torsion, causing abdominal pain, especially low in the lower quadrants. Could be pyelonephritis, nephrolithiasis, producing abdominal pain. This by working this way, you can generate a good list of hypotheses and maximize your learning, and you could input lots of mechanisms that could produce such symptoms.